Might be the hotline
There
right
you
there
go.
calling us
That's
in.
calling
Huh?
us in. But then the doctors, we have it in the back too. If the doctor's going to go see a patient and needs a language, we have it back there that he can use, not his portable phone. He just dial it in. A lot of times we do it for him, and then he gets someone to connect to it. But it is readily available on the phone. Just like poison, another important one, the poison control line. If you have any questions, because we get a lot of kids that come in and maybe get into something they shouldn't. So that's another important number that we keep. It's a poison control line.
I can imagine that.
So those two are right there, readily accessible.
So Mary, thank you so much for doing this interview and explaining some of the struggles that you came through in your career as far as communication barriers, whether it be through language or reactions or one person's culture. It seems like what you're trying to say is if you can't find ways to communicate with somebody as far as language, you should use your experience as a new nurse to kind of help you guide yourself in taking care of that patient.
And ask for help. It's not a weakness to ask for help. It's shown in nursing career, in my nursing career that I've always been taught, and I've taught others, is that by asking for help, it shows you want to learn, and that you're strong enough to know you don't know how to do this one. And it's not a bad thing. It's a good thing because it's a teamwork. One nurse cannot cure everybody, but a group of nurses can. We can make a difference. So that's when I started with nursing school. Our theme was working together with helping hands, and that's what I've kind of carried on since I graduated. That was our theme when we graduated: working together with helping hands. And that's what you got to do. You know, lend that helping hand. If you don't have it, get somebody else to do it with you, and then everybody will be taken care of, and patients will get what they need.
Any other final comments before we head off?
All I can say is I know sometimes you hear a bad rap about nursing. It's not what it's all cracked up to be. But if you really, really feel a calling to help others, and you don't mind a little blood and guts every now and then, it doesn't have to be gory. You don't have to do all the trauma stuff that you see on TV and all that. That nursing is still, it's a very rewarding profession. Hard, yes, but no job that really makes a difference in the world is going to be easy. But we do need good, caring, qualified nurses out there, and I would never change a thing. I'm so glad I had the opportunity when I was older to go back to nursing school. I would not be the person I am today if I hadn't.
Right.
I just believe in the nursing profession. And it's not just for women, guys. We need guys too. More and more guys are getting into it, and it's good. It's a nice balance. So I like seeing the male nurses come in.
Okay. Again, thank you. This is Mary Alston, and I'm David Branning. Thank you again, Mary, for having this interview with me.
Thank you, David.
And you have a good night.
You too. Nice to meet you.
Thank you.
So I wasn't the oldest,
Right.
and the older students seemed to do better. So we kind of pulled together and pulled each other along.
Any particular reason you chose Florida School at St. Petersburg?
Well, my husband was in the military for 13 and a half years.
Okay.
So his job took him down there when he got out. And it was hard to find a satisfying job down there in the healthcare field. So I said, I need to improve. I need to do more. I'm not going to stay with just being a front office, clerical type job. That I wanted more. So when the opportunity came, I took advantage of it.
Okay. Okay, so 2.5 years goes by, you fast track, and you went in immediately as a triage nurse.
No, actually I started as a staff nurse on a med-surg floor. It was like a respiratory med-surg. So it'd be more like a general nurse to take care of the people that would be in for pneumonia, cardiac issues.
Like the flu and sick.
Right, just, you know, general, and I did that for about 1.5 years. And then I moved to the emergency room, and that's when all the triage and emergency room physicians started.
Wow, so 1.5 years,
About a year and a half.
you fast tracked.
Mm-hmm.
I know there's a few different types of nurses.
Mm-hmm.
Where does being a triage nurse fit amongst the other titles of the nurses? There's
Well,
how many?
we're all staff nurses. If you're
Okay.
working in a hospital setting, you'd all be classified as a staff nurse.
Okay.
You have to be specially trained for the emergency room, and then beyond just taking care of patients in the rooms, the person who is triage has to have advanced, not so much extra college, but more education and training into the specifics of the triage, because triage is a specific area of the emergency room.
Okay. So did they send you back to school after that 1.5 years of being a staffing nurse, or was that more of on the job training?
They'll be on the job. once you transfer into like a different department, say you went from a floor nurse to ICU, it's a specialized care, so you need more training that isn't actually going back to college, but within the hospital or the company you're working for, they would provide you additional classroom training.
Okay, great. So they saw something in you after only a year and a half. Is that considered fast tracking to move to a triage nurse after being a staffing nurse only a year and a half?
I think that it just depends on the individual. Some pick up things faster, and you have certain criteria, like you need to be able to quickly assess a patient, because you don't have a lot of time in triage, because you're the first person to see this, everybody who walks into the emergency room.
Okay.
So you have to have good assessment skills, good quick thinking, being able to know if someone looks bad. So there's a lot of key points that you look at. And we have some criteria. And then sometimes you even go, like, we always talk about 5 senses, your smelling, hearing, and all that. Well, like a mother, you have your 6th sense. As a nurse, you use your 6th sense quite often.
Okay.
And triage has to have a good 6th sense.
Right. So what's your first, what do you want to call it, assignment for being that staffing nurse?
Probably was when I was working in a small community hospital in Tennessee. We had a very small ER at that time. And I was on a med surge, and then I would float to different areas to gain experience, to gain knowledge, and pulling all those different type of assessments together, I was able to do some shifts in the ER, and I kind of liked it. So by proving yourself to the people you were working for, opened the doors to go down there.
Was it your husband's job as being in the military that moved you to Tennessee, or was that a position that you found open to get you at your start of your career?
When I graduated, we were living in Florida.
Right.
And he was working, I was working, and then his job went away, and we moved to Tennessee because he always wanted to own a farm.
Okay, great.
So we bought some acreage at our farm. The company that let him go hired him back. So we stayed in Tennessee for 5 years, and that's where the job opened up at the community hospital.
Okay, great.
And then, that's a good place to kind of get your feet wet and build on your skills and move your way up into different areas, because they like to keep everybody. It's almost like a community hospital is more like a small family compared to a big teaching hospital, something like that. So I kind of lean towards a smaller hospital.
Okay, great. More personable.
Mm-hmm.
So this doesn't seem like your average 9 to 5 job. What kind of hours does it consist of being that staff nurse and then later on being that triage nurse?
Well, with nursing, most places you have to do 24/7 if you're in a hospital type setting, or if you're in urgent care, or now they have freestanding 24-hour emergency rooms. So it's a 24/7 job. So most of us do 12-hour shifts. We do 3 12s one week, 4 12s the next. And so it's day and night. And I've done more night shift than day shift. It's just the way it's worked out. But I like the night shift because you have more autonomy. Nobody's hovering over you. You work as a team and you get the job done.
Okay. And once that kind of 12-hour shift ends, do they kind of give you like a doctor or pager to kind of say, hey, we might need you, we're going to give you a beep, or is that just you're completely off?
We are off, and they can call us. They have to give us 8 hours off.
Okay.
You have to have a minimum of 8 hours in between shifts. They can ask us to come in extra, but we're not. It's not mandatory. It's not like certain areas of nursing you are on call. Like the OR people have to be on call because you never know when a case might come in after hours. Cardiac, cath lab, they have to be on call. That's the one thing I like about the emergency is that we don't have to be on call.
Okay.
So when I'm done, I'm done. I go home.
Okay. Seems like it has its advantages. When you go through that long workday, do you feel like there's a sense of completion, like you've completed the job, or do you feel like it's never ending with the job that you do of taking care of people on a consistent basis?
Well, that's the one difference between like the emergency room being a floor nurse. On the floor, you might have 3 or 4 days, taking care of that same patient. They're in the hospital, they're sick, they got to get better. But in the ER, we don't keep them that long. So it's a constant turnover. So you have a lot of completion, because you might have a really patient that's in a lot of pain when they come in. They might have a broken bone or a bad cut, but you fix them up and then you send them home. So that's a completion with each one of those patients. Now if they get admitted, it's not completed, but you hope you start them on the road to completion. So it varies.
Okay.
I know when I leave for that day that I've done all I can for the patients that I've seen, and that if there's still some left, the next shift is going to continue us